this branch is also defined as a very highly infective branch. Is that part true?
Definitely, it is very one of the most infectious branch because
The pros and cons of this field.
highlight about the pros. कि it's a dedicated branch.
What is the basic difference between respiratory medicine and TB chest branch?
Initially, all the respiratory specialists, the pulmonologists, they were treating the TB.
Is this branch suitable for females?
I would say females are a bit skeptical taking up the pulmonology.
Is there any business opportunities also available in this field?
It's a mix of the, I would say, biotechnology.
How much does a pulmonologist earn in our country? Today, we are going to discuss about one of the most requested branches in our podcast, which is pulmonology. I would say it is one of the most undervalued but an impactful branch of medicine. And we have a guest who has more than 13 years of experience. He is the director and head of department at Apollo Pusa Road, New Delhi. And he is the founder director of Rebreathe Clinic, a center focused on respiratory issues and sleep apnea. He has an international training from USA in sleep apnea, and he is an expert in fields of tuberculosis, emphysema, asthma, and sleep disorders. He is a graduate from UCMS Delhi, DNB from Patel Chest, and also an MBA in hospital management and healthcare. So many degrees, so much experience. Let's put our hands together and let's call the man with multiple hats, Dr. Harish Bhatia. So, hi, Dr. Harish. Welcome to the Nachiket Bhatia show.
Thank you.
So, Dr. Harish, before we get on to pulmonology as a branch, and I'll tell you, this was like the most requested branch to be podcasted on our show. So, before we get into that, I would like to know the complete journey of Dr. Harish Bhatia. How did you start? Why did you choose medicine as your career? And how did you end up being director into one of the top, institutes of our country?
Thank you, Nachiket, for having me here in your show. So first of all, I have done my MBBS from UCMS, that is from Delhi University. Then I always wanted to do the medicine as a branch, but because the rank which I got during my PG examination was probably not very good. Probably I didn't join your institute. Maybe I would have got it. So then I chose because I wanted medicine. And side by side, I wanted to end my career. I wanted to choose something so that I can pursue throughout my life. And so I went for the DDCD, that is Diploma in TB and Chest Diseases. Then I went for the DNB in Respiratory Medicine, that is from the National Institute of TB and Respiratory Disease. So I am one of the very few people in India who have had the opportunity to be associated with the two topmost institutes of India. Because NITRD is an institute of national importance and VP Chess Institute is also very, very elite Delhi University Institute, which is in the North Campus. So why I went for the pulmonology is a very, very good question. First of all, it is a terminal branch because though there is a DM and all those things, but I wanted it to be a terminal branch. So another reason because the pollution levels are rising. So I saw some opportunity in that because see if you see the Delhis or the metros, or even in fact even if you go to any hilly areas, still we have a pollution on the tune of around 160, 150. So the lot of urbanization is taking place in India. So I saw the opportunity. And the another reason that my mom, when I was doing MBBS, she was diagnosed with the COPD. Initially, it presumed to be ILD. Then she was diagnosed it to be COPD. So though most of the general practitioner or the medicine people are also treating the COPD, but I always wanted it to, take her to the specialist. So there I saw some opportunity, and it involves so many other things, allied like the sleep medicine, allergies, and the critical care medicine. So that is the reason I went for the pulmonary medicine.
Pulmonology is a very undervalued and underappreciated branch in India.
Yeah.
Although highly impactful. Do you also have this opinion? It is undervalued?
Yeah, because see, because it is the mindset. Because whenever you go to any, let's say, you have a cough or you have a breathlessness, or because these are the two reasons the people are going to the I'm in the general practitioners. So उसी वजह से आई थिंक दैट इज द प्रिसाइजली द रीजन. और इसमें इंटरवेंशंस की जरूरत है, तो इट्स अ मिक्स ऑफ द इंटरवेंशन एंड द ओपीडी प्रैक्टिस. So because OPD practice have already been taken by the GPs, the MD medicine people and the MBBS people. So after the जब के बाद में लोगों को समझ आया ना कि भाई अब तो बायलैटरल निमोनिया आ गया, पेशेंट का 25 स्कोरिंग हो गई, तब लोगों को पल्मोनोलॉजी की इंपॉर्टेंस समझ आई. शायद अगर मैं बोलूँ तो हमें भी तब समझ आई कि पल्मोनोलॉजी व्हाट दिस ब्रांच इज ऑल अबाउट, बिकॉज द एक्सपर्टीज विच वी were taught during the training time, because I was hooked to the ventilators and the NIV and the HFNC. आपने देखा होगा ना उस समय बहुत वो था. तो I think at that time we realized why the pulmonology is a very good branch to be at, and why we need the dedicated people, because if somebody has come across any ARDS हो गया, pneumonia हो गया, so वहाँ हमें समझ आया कि where lies the difference.
You're also a director in one of the most top institutes of a country.
Yeah.
Into Apollo. That's a very
Yeah,
big thing.
yeah.
So how did you land up that? What's the secret behind it?
So again, it's I started my journey with the Chanand Devi Hospital. Initially, during times I was associated with few of the hospital like Saigal Neo Hospital. Then I started the major breakthrough. I got the working with the Chanand Devi Hospital, and the one of the very very good senior, I must take his name, Dr. Chandramani Punjabi. He's been in this specialty from last 20-25 years. So I got an opportunity to how you practice the pulmonology, and as a person how you want to grow in pulmonology, because he is very very one of the very very leading, or maybe the legend of the pulmonology. So then I was doing well. I was doing well in my clinic, catering to around 40-50 patients in a day after the COVID. Then the the even the market, because everybody has some sort of market people. The Apollo people, they come, they just called me and they approached me ki if you wanted to take up this position, and we really wanted you to be there to head the department. So then I grabbed the opportunity, and then there is no looking back, and that is the reason probably I am here.
That's great, boss.
Yeah.
Boss, let's talk about pulmonology as a career branch.
Okay.
So many of our young doctors are thinking of choosing this branch as their career. Now, I would like you to describe the pros and cons of this field.
See, it's first of all, it is a very good question. So the first I would like to highlight about the pros. It's a dedicated branch. I have already emphasized that the urbanization is taking place, a lot of pollution is there, and imagine the people are actually moving out of Delhi to some other areas, and they are just leaving their home and the businesses and everything, because they just wanted to get rid of, and the newcomers have been added, like the first time visas, first time presenting with the bronchial asthma or the COPD or any interstitial lung disease. So with the advent of the urbanization, so this becomes a problem. So it has a very good future, and you can practice in the sleep medicine, although we have some overlapping with the neurologists, because neurologists, they also practice the sleep medicine. So you can also practice the sleep medicine. You can also, if you want to set up your allergy clinic is a very very something which is demanded, because now see, अभी आजकल का जो ज़माना है ना, आजकल हमारे पास टारगेटेड मिसाइल्स हैं कि भाई फलाने बंदे को हमने देखा, मिसाइल के ऊपर उसका नाम लिखा और लेज़र गाइडेड मिसाइल है, उसको मार दिया. सो द टुडेज एरा इज अ guided targeted based therapy. So actually whenever we talk about any allergy or anything, so the patient want to know कि sir, what kind of allergy I have. So there we can set up allergy clinic, and probably we can earn a lot of revenue out of it. A lot of people are in Delhi, they are doing it, in the across the country they are doing it, and there is a fellowship programs after the completion of the MD or the DMs for this thing. You can always set up the sleep lab, and I would tell you the sleep lab, why sleep lab is very very important. So we are in the digital era, so we have just 24 hours in a day, so 7 to 8 hours are the fixed. And it has been from the last so many years, ever since the human civilization has taken place. So this has not changed. So that is the importance of sleep. So imagine, and it is not being covered in any of the insurances, in the TPAs or anything. So once you set up your sleep clinic, because everybody wants to figure out ki what is happening with the people, why people are not getting enough sleep and why they are sleeping so much. So it's a actually revenue generating branch. Another thing is, which is very fascinating for others, might not be fascinating for me, is the critical care, because majority of the hospitals, the corporate hospitals or even the smaller ones, I would say tier 2, tier 3, they have been managed by, initially they were managed by the anesthetist. Now they are being managed by the pulmonologist. So it's the full pros for that. And cons is, see, again you have some cons, because the if you are treating any asthma patients, any ILD patients, or any sort of patients, or TB patients, even the MD medicine or the general practitioner can give the medicine. Everybody knows what sort of inhalers are there, what sort of medicines are there. So everybody can practice. But what they cannot do is the intervention part. So intervention is a plus, and rest everything, because it is a mix of around 70% of the practice and 30%, 70% of the practice, 30% of the invasive procedures. So one can always take advantage out of that.
This branch is also defined as a very highly infective branch
Yes.
because you're dealing with TB patients and
Yes.
the infection can pass on. So it's also called a very scary branch. Is that part true?
Yes, because I'm the one, probably every pulmonologist, though they have limited the elder, I mean the aged people, the who are already into the practice from so many years, they have opted out of treating the TB patients, because we have got the drug sensitive TB, drug resistant TB in the form of pre-XDR, XDR TB, and so many other kinds of TB. So probably some people have just taken some space from treating the TBs, and we have got the programs in India like the NTEP, that is the National Tubercular Elimination Program, and the PMDT, that is Programmatic Management of the Drug Resistant TB. So we have got very good programs. Even the government is doing incredibly fine. So, but definitely it is very one of the most infectious branch, because you tend to see the patients with the bilateral pneumonitis. Imagine, I would just talk about the COVID era, because there we used to wear the all the PP, all the precautions, and in fact I had the as well. My father had, everybody had. So, but I think once you are in this profession, once you are army decided to be at the border, so of course the bullet can hit you here and there, and you may die as well. So but the job of a army man or anybody who who is there for that profession, so we should not think about those, that we may contradict the disease or we may not. So I think that is a limitation for some people.
So I'll ask you a very layman question. What is the basic difference between respiratory medicine and TB chest branch?
Okay. So initially it was started with the TB only, because initially the all the respiratory specialists, the pulmonologists, they were treating the TB. Then the government had some, because the advent of the medical colleges, and they just because the I'll tell you a brief story. Initially, because you must have heard about the rheumatoid arthritis. So I would say just 10 years down the line, nobody has heard of anything which is a RAILD. That is rheumatoid arthritis associated interstitial lung disease. Because rheumatoid arthritis patient, by default, they cannot walk. So once you cannot walk, so you cannot have any breathlessness. So breathlessness is something which is a feeling from inside. It is a perception. So once this branch was set up, I get to see around 10% of the patients every month in my OPD, on the tune of around 30, 40 patients in a month for the RA associated ILD. And initially they were ignored. So same happened with the branch. So once the branch, they have modified it to the TB chest, then the pulmonology or the critical care and the sleep medicine, the branch also got developed. So probably this was the reason.
Boss, what do you say? How's the family life, work-life balance in this pulmonology field?
So totally, family life depends on, because once you are into the critical care, and that too you are from a 9 to 5 job, and you may have to rush during the night to cater to the patients, then there is a problem. Otherwise it is a pretty light branch, barring some seasonal variations, because whenever there is a change of season or there is a the once we enter into the sardi and the garmi and the rainy season, so there are some exacerbation of the ailments, respiratory ailments. Otherwise it's a pretty good branch, I would say. It's a balance of the OPD and the invasive procedures.
So can we say that it has a like a minimum number of emergencies?
Yes, yes. So even I get to see hardly once in a month emergency, because majority of the time it is elective. Let's say ki somebody is treating the foreign body. The foreign body got stuck in the trachea. There is an emergency, but there are very very few cases. Very very few cases. I would have to rush, or maybe the pneumothorax because and pneumothorax is also being treated by the anesthetist, being the emergency medicine specialist, being the whosoever is handling the, because there is a branch, there is a separate people have done in the IDCCM, that is Indian Diploma in Critical Care Medicine. Even they can handle such things. So, and it is evolving, because we have been repeatedly called for the bariatric surgery. There I get a because we have to make a conduit, because either they will go for the nasal intubation or they will go for the oral intubation. So bariatric surgery mein it is very very difficult, because you cannot have access to the vocal cords. So I just show them the way how to go about it.
Boss, what are the super specialty potentials for this branch?
See, super specialty, once you complete your MD pulmonary medicine or DNB pulmonary or respiratory medicine, you can go for the DM in cardiology. So I am not very comfortable going for the cardiology, because you are competing with the MD medicine people. So MD medicine people, they have a exposure of practically every branch during their MD tenure. So you have no experience. Once you have done the MBBS, in the MBBS level, you might have some cardiology, exposure. So during your MD pulmonary medicine, so I would say they neither they are neither the respiratory medicine specialist, neither they are good cardiologist. So, but you can of course go for it. And some people, just manifest in a different way, because I was taking care of the lungs. Now I am taking care of the lungs and the heart. So I am a very good doctor. So it is a manifestation. So one may have a different preferences. Another thing, you can go for the sleep medicine, you can go for the critical care medicine, and you can go for even the DM in pulmonary and the sleep medicine and pulmonary and critical care medicine.
Any other fellowships that are there for this branch?
Yes, there are few. The interventional pulmonology fellowships are there in across India. I think the South India is doing incredibly well. In the tune of the Amrita Hospital and some 3-4 hospitals are there. They are very good. They have robotic systems, and they have some where you can actually practice, like you have an aircraft. There is a virtual, so you can do the virtual all the procedures. So they have the simulation rooms, I would say. And the lot of people in the North India, they are also offering some course, but they are not the recognized by the the body, that the medical council body. But they can go for the allergic medicine. They can go for the sleep medicine, like I have done this fellowship in the sleep medicine from USA. So they can go for the various courses after the DM pulmonary medicine.
Is this branch suitable for females?
It's a very good question. So people, I would say females are a bit skeptical taking up the pulmonology. There is only fear, that is the TB. Because once they might expose to the Mycobacterium tuberculosis, because I had one female with me, and she was also, every time she was crying, why the hell there is a MDR patient, XDR patient given to us, because they have to reproduce, they have to bring a baby. So they are little bit scared, but as such there is no risk, because I have had the opportunity, because my guide was the Dr. Rohit Sareen, Dr. Behra, who has been conferred with the Padma Shri Award in the PGI Chandigarh. So there, even if we are we have seen the MDR patients, that is the multi drug resistant patients, So patient, it is advisable that the patient should wear a mask and we should maintain a separate distance. And there are negative pressures rooms where actually there are hardly any risk for any transmission. So there are all the precautions. The government has the all the facilities, and we have taken all the precautions while during the training.
How would you describe the difference between MD respiratory medicine and DNB respiratory medicine?
So there is I would say, hardly any difference between the DNB pulmonary medicine. The only difference is initially there was a TB and chest medicine. Then the DNB, because DNB people are not actually exposed to the somehow the, I would say, the ICU environments and on the tune of the some sleep medicine. So there lies a slight difference, but in majority of the places, the good places like the Gangaram Hospital, which is offering the DNB, even the NIT where I've had my education, we have been just went through everything, the sleep medicine and the critical care part. Otherwise, there is hardly any difference. Another difference is because once you appear for the AP, that is the assistant professor. So there, I think there was some issues with the National Medical Commission, but I think they have sorted it out. Now you can also go for the APs. Post DNB, you have to do the SRship, and then your qualification is being recognized. Now it is being widely recognized.
So, do you think there is any discrepancy or segregation while you're going for a job that MD might be preferred over DNB?
Yes, I would say yes. So initially, I would say it was there, but somehow the MD people or the people who have done the DM or the DNB people. So I would say rather DNB people, मतलब वो खुद सोचते हैं कि मैं थोड़ा सा कम हूँ, मुझे लगता है. It is not actually that. But as such, there is no difference between the MD pulmonology, and because once you have done and in fact the people mindset also I talk about. Once there is a board which says you are MD pulmonary medicine and that says DNB pulmonary medicine. I think the people in the layman, the patients who are actually coming to meet you, they find some difference. Ki he is not MD. I think there only lies the difference. Otherwise, there is no difference as far as the expertise or the qualification or the, I would say, the experience or everything is concerned. Yeah.
Boss, what are the job potentials for a pulmonologist?
See, job potentials, the corporates, you can go for the corporates. You can go and join any medical college, be it a private medical college or the government medical college. So you have a lot of prospects. So you can even head the respiratory intensive care unit. You can head the critical care part, because I've already told you, because a lot of people are actually going into it. So I won't see the job as a problem, because there are hardly any pulmonologists in India. Because we have seen during the COVID times, even the dentist, even the psychiatrist or the dermatology people have, they have to pitch in, because we were really short of the resources. So I think it's a good branch. And there are no, as such, see, cardiology has already, the flooded up with so many people are DNB cardiology, and still we have a lot of space for the pulmonology.
What do you think are the potential, opportunities abroad for a pulmonologist?
So one of my friend is working in the US, I think possibly in Chicago. So he always tells me, okay, why don't you come here? There's a lot of scope. Because I initially at the talk of my podcast, I told you, because there is urbanization. Whenever there is a lot of people into the vaping, into the hookah smoking, so the non-communicable diseases, they just are on rise. And I would say the third most common cause of cancer is a lung cancer. So pulmonology is definitely the promising field. So one can, and in fact, during the times I went for the exam, that is Dubai Health Administration. And it was only last year that I went for the interview in the Esther's Healthcare. So I got selected, and they are giving me very good money. And I would say beyond my imaginations, they are giving me all the free accommodations and everything, whatever is there to, support your lifestyle. So, but somehow personally, I don't want to go out of India, because government has spent a lot of money on us, and it is my duty to, serve to the countrymen.
Boss, can you just tell me top 5 institutes of MD pulmonary medicine in India and top 5 DNB institutes?
First of all, top 5 MD pulmonary medicine is Vallabhbhai Patel Chest Institute in Delhi, and the KEM that is in Mumbai. Another is that is the I believe PGI Rohtak is very good institute, and I think two institutes. One is Amrita, which is a private institute, is a very good, having a very good exposure to the pulmonary medicine, and the Manipal. They are very good. And another, last but not the least, is KGMU, that is King George Medical University. They're offering a very good pulmonology. Then DNB. DNB in Delhi, if we talk about, is NITRD, and the Gangaram Hospital, Apollo Hospital, and the Rajan Babu TB Hospital, Delhi. And I am not really very sure about the other the states. Metro Center for Respiratory Diseases, that is in Noida. They are offering a very good DNB pulmonology program.
Which are the best institute for DM pulmonology in India?
Sir, first of all is definitely the AIMS, New Delhi. There are various AIMS they are actually providing. And the second number is Safdarjung, that is VMMC. And the third one is the Patel Chest, Vallabhbhai Patel Chest Institute. Fourth one is the PGI Chandigarh, in no particular order, I would say. PGI Chandigarh and the PGI Rohtak. Probably they are offering the best of the programs.
Let me ask you the most asked question of our own podcast, and which is, how much does a pulmonologist earn in our country? As a person who has just crossed his post graduation after 10 years, after 20 years.
So normally once you pass your DM, you can directly go to the any corporate hospital, and somehow you are getting between close to 30-40 lakhs per annum, which is around 2.5 lakhs. It is very easy. Very easy. They are
What
getting.
about an SR?
So MD, post MD, you can easily earn around 1.5 to 1.6 lakhs per month. Then 10 years after completion of your post graduation, easily around up to 10 lakhs per month. And after 20 years, then it is just a number, maybe 25 lakhs, 30 lakhs, and it is just a number. Maybe you can reach up to 50 lakhs per month.
Like, do you think that there is a ceiling on this branch?
I don't think so.
Well, let's talk about your own private practice, because many of our audience who have their ambition of starting their own clinics, their own private practices,
Okay.
they often wonder how to actually take the first step, because we all see big setups like Apollo, Medanta, Max, and we think कि इसको बनाने में तो 1,000 crore चाहिए, ठीक है? But they forget that everything started from a very small setup. So you have made your own setup itself. You're working very well in the field of pulmonology. So my question to you is, what is the basic capital required to start your own pulmonology practice? All right, I'm not asking for a general GP practice, a pulmonology practice, and what should be included in the starting setup?
Okay. So again, it is a very good question. First of all, so I'm not talking about a space, whether you own it or whether it is on rent. I will not talk about the space. I will just talk about the logistics. So around 25 lakhs, you can easily start your practice to begin with. You can have a bronchoscope there. You can do in clinic, which comes around 5 to 6 lakhs easily. And you can set up your even allergy clinic, which is very cheap, around 40-50,000. You can buy your PFT machines, which is around 1 lakh. And rest of the things, some nebulizers, some BiPAP, some oxygen concentrators, because there you get to treat patients with actually who are coming to you for the breathlessness. And you want something like a first aid, because you might not be admitting those patients, but you still have something to offer them. So I would say 25 lakhs is just you require to set up a good clinic. It's a good clinic.
What should be the size?
Size, because I have got around my clinic is close to around 1,800 square feet. So size, I would say maybe around 500-600 square would be enough. So if you wanted to go for that is pulmonary rehabilitation, that is totally separate entity, because that is also being recognized these days. Because what happens is, those patients who are on chronically oxygen therapy, so they want something, because they cannot exercise, they can't move out because they are dependent on oxygen. So it is rehabilitation is a separate branch. So there we have a CPET, that is cardiopulmonary exercise testing. So that setup is quite expensive, and that area, that I think you require another 500 square feet of area for to set up the CPET, and that would cost you around 20-25 lakhs more.
Boss, you have made your journey from a DNB resident to a private practitioner to a director of a hospital. What would you recommend? When should a new pulmonologist, a young pulmonologist, think of starting his own clinic? Like how much gap there should be between MD, DNB and the opening of the clinic?
So I would say start your clinic ASAP, as soon as possible, because Rome was not built in a day. It takes time to build your practice, your rapport with the patients. So I would say start as early as possible. Associate yourself with some hospitals, probably if not the 9 to 5 or maybe for few hours, because we need to have a backup. See, the bilateral pneumonia patients, COVID patients coming to your clinic, you cannot treat those patients in your clinic. It is very, very simple. You need to have a backup. You need to have a ventilators. You need to have a HFNC. You need to have a central oxygen line. So there are so many things that you needed actually to admit the patients. So I would suggest through your medium, have some backup with the good hospitals where they have some good ICU setup, good pulmonology equipments are there, ventilators are there, BiPAPs are there, and you can start your, because it's a mix of 70% it will be your purely your practice, that is OPD practice, and 30% intervention is there.
But as a private practitioner, this is my question to you that the biggest question a young pulmonologist might have is that in this whole big city, okay, but whatever the size might be, whatever the city might be, first, second, third tier, the question is, where should I open my clinic? What would be your suggestion for that?
So even I have had the same option when I opened my clinic in 2018. So I just looked at the shop. There was a very small, around 50 square feet, hardly 100 square feet shop. So I just had 2-3 things in mind, because once the patient is going to come into my clinic, I should not have the stairs. It should be on the ground floor. That is the first thing you have to see. And it should have a toilet, mandatory toilet, because you can't tell, because once you have given Lasix injection, furosemide injection to the patient who has some sort of lung element and there is some cardiac component is there. So if you have given injection to the patient is going to go for the pee, where the patient is going to urinate, and patient is already breathless, and now you are just telling the patient to go there to look for the any loo, no any toilet. So the clinic should be on the ground floor first, or if it is on the upper floors, you should have a lift with the proper the stretcher at least space or the wheelchair space. Second thing, you should have all the backups in the form of the concentrators if electricity is there, and if electricity is not there, then you should have at least backup for the cylinders, because that patient is rarely breathless. Imagine the patients are coming to me with a 65% saturation. That patient may die anytime. So I think these 2-3, and you should have enough space, because the properly ventilated, the air curtain should be there. It should not be in the area where it is highly exposed to the pollution. So I think the young generation, the young people who are about to, or they're already pursuing this. This is the message from my side. I think you should take these things into the consideration.
What any marketing tips that you would like to tell our audience how to promote their clinic?
See, first of all, it is very, very important. See, 70% of the drugs which I'm giving it to my patient, still they are complaining that their breathlessness is not going away, because you have not given time to the patients, because they have not been told how to take this medicine properly. So you have to see the category of patient that you are choosing. Let's say if somebody is a 70 years of age with some psychotic illness, I would say Parkinsonism or Alzheimer's, they have a problem with the hand-eye coordination. If you give them the inhaler, it is not going to work, because they can't understand what you are talking about. They can't, visualize how to take the inhalers. So you have to give them something which is customized and probably which will help the patient, because it is only the 30% of the drug which is actually will go inside. And imagine 70% of the ultimately drug is also going to get wasted away, and 30% would be enough to have a 100% response in the patient. So every time you need to check the techniques, how you are, if the patient is taking the drugs in a correct manner, prescribed manner, you have to have some plans, written plans, like you have some plan in the diabetes. You ask the patient to check for the sugar. You up morning may you check the sugar, you check the after meals. Accordingly, you take the insulin. Like you have a BP reading, that is the people now people are also watching the sleep scoring in their watch, which is called a actigraphy. So same you have to have a plan. So I think then only you can be and you have a empathy. You have a empathy towards the patient, and probably that is the key. You can you might be the Nachiket Bhatia is also waiting for you to come to my in my place in coming times. So this is the key.
What are the extra skills that you would recommend our audience that if you want to be a good private practitioner, these are the skills that you must acquire before opening your practice?
See, again, Nachiket, it is a very good question because the Indian education is, we have never been, told how to manage the stuff financially. We have not been financially educated. So I think when I did the MBA in the healthcare from University of Virginia, I think that changed the entire chapter of my life, because there I learned how to speak to the patient, how to pass to the some I would say news breaking, because when the patient is on verge of dying, or how to respond to the patient's queries. So I think you should know the art how you take up such challenges. So you should be very very careful with your words, because it may put you in trouble, it may just take you out of trouble. So you should be very very careful. Otherwise, the only thing, you should have a compassion, you should have the empathy, and you should have a pain that somebody is coming to you, because that patient is also somehow suffering somewhere here and there. So and another thing, I just tell you the example. The one of the very famous cardiologist, the patient went to the cardiologist, and can I take the name of the cardiologist?
Please.
Dr. JPS Sani. He's a director of the Gangaram. He's a very and Dr. Sani has given some medicine, and that patient had continuous breathlessness, and patient came to me. So I wrote a letter to respected Dr. Sani Saab. I wrote a letter ki sir, if you could please remove the medicine, because that medicine causes the breathlessness in the patient. The patient was on beta blockers. So I just wrote the letter, and patient went to Dr. Sani, and he was so happy to see my prescription. He called me and he said, "Thank you so much, Dr. Bhatia." And patient came to me, because I have not written anything to the patient. I've just thorough with the examination, thorough with the history taking, and I just changed the medicine, and entire thing got changed. The patient was absolutely okay. So this is the kind of commitment that you require. It is not only the medicine which you are going to give it to the patient, it is how you take the history, why the patient is having breathlessness, because you really go down to the bottom to find out the cause for the breathlessness.
Boss, would you like to share some interesting cases that you have seen?
Yeah, the patient, he was when I was doing training in NIT, the patient of somewhere around 32 years age, completely blind, came to my clinic, came to my OPD. So I thought, why he has come to my OPD? He is not able to see. I'm not the ophthalmologist. I can't see such patients. Anyhow, I kept my cool. I just told his wife to just sit on the chairs, and we just then, after the repeated history and everything, so patient has a recurrent uveitis. So recurrent uveitis was somehow ignored. I don't know how was ignored. So patient was complaining again. My eyes, there was some redness in my eyes, and I was constantly putting in some water, dropping out the water from my eyes, and nobody just took care of anything. Then he went to me. He came to me. So I inquired. So I thought this might be sarcoidosis, and since because there was only flash of light in his eyes, I could just put the torch into the eyes, and he just sense it कि there is some light in the eyes. Imagine after the 15 days when I started the treatment, he could see me. He just, just came and just greeted me. He hugged me. And the feeling which I had, and still I'm having the goosebumps, because just after the 15 days of giving the steroids, that too empirically, I did not go into the depth of, diagnosing it. I just gave it empirically. And he improved dramatically, that he could see at the vision was 6 by 6 after 15 days of giving the high dose of steroids. So that was, I mean, I just can't imagine. So I have treated that patient. And during the COVID times, clinic mein, when patient, they are coming to me, sir, aapne mujhe bacha liya. Sir, you have saved me. And sir, my lungs was 25 out of 25 score. There was hardly any space in the lungs. Sir, you have intervened and you have saved me. I think these are the words to be, to keep it with you, to near to your heart. So these are the words that keeps me going. Apart from the money and all those things that you are doing.
That's beautiful, boss. That's
Thank you.
really God's work that you are doing.
Thank you.
And I think with this we come to the end of our phase one of our discussion. We move to the rapid fire round. I think you will give some interesting answers, boss. So it's very simple. That what we are going to do.
Okay.
Like you have to be super truthful and super spontaneous.
Okay.
But that was actually a very beautiful story. If you can give your vision back to somebody, I think again you're doing God's work.
Okay. Thank
That's
you.
it.
Thank you.
Thank you so much, boss, for that. Lovely story. So, boss, how do you spend your free day? The best way you want to spend your free day?
So, Nachiket, I am the very family kind of person. Either I am working or I am spending time with my family. Even if I go to any holidays, I don't have, don't have a lot of friends. So whatever time I have, just give it to my family and to the gymming and the any kind of sports activity. If not doing anything, just walking. Just walking and walking.
Great. A dream travel destination on your bucket list?
It's Switzerland. I have been there for some conference. So, and the Amsterdam. So I
Beautiful,
never been to Amsterdam. So really wanted to go there. But Switzerland is, I have been to the Lausanne, Interlaken. It was amazing. It was mind blowing.
Inspiration of your life?
See, inspiration, because I draw the inspiration from, a lot of walks of the life. Because if I look at the Virat Kohli, so there is a lot of, things to learn from. If I look at the Hardik Pandya, if I look at the Modi ji, and if I look at the Sunita Williams, it is pure patience, because you went for the trip of around 6 days and you are coming back after 9 months. And that too, because see, she has got a baby feet. You know what is baby feet? Because babies, the proprioception has not been developed. The joints have not been, tuned to the, adjust to the gravity. So probably she won't be able to walk for maybe next few days. And now she will learn the art of walking because she was in a zero gravity state. So imagine, so even you can learn a lot of things from the rickshaw wala or a Zomato guy or a Swiggy guy or anybody. So I get to learn from a lot of people, whosoever is giving me anything which can actually improve me. So I take the inspiration from. I am that kind of guy. And another thing is my wife. She is the biggest pillar to my support. And I would take her name, Sakshi Rathore. She is a mother of 3 kids. And I have 2 daughters, 9 years and 7 years. Recently been blessed with a son who is 6.5 months. His name is Ishai Bhatia. And she is the pillar of my everything. Whatever I am today, it is all attributed, I just attribute to her.
Congratulations for
Thank
the
you.
beautiful family.
Thank you.
The last series you have watched?
So I think I watched somewhere around the Patal Lok season 1.
Season 1?
Yeah. Yeah. I am not very Netflix, Amazon. So whatever time I spend with my, I used to, I just see watching some old movies. Old movies like we watched recently around 7-8 days back. There was a movie, Amrit. You have heard about Rajesh Khanna's movie. It's a because I wanted to give my kids some lessons, because it is a full of the, explicit material. So I usually refrain from, seeing, and usually I spend the quality time. Listen to the Alexa, listen to the music. I play the sound box. I play that. So I just do in my these stuff I'm doing matlab when I'm free. Yeah.
Great, boss. With this, we come to the end of our podcast.
Thank you.
Thank you so much for such
Thank
an
you.
in-depth discussion. I think you have given us everything we need to know about pulmonology, respiratory medicine. And I think I would like to thank you on behalf of our audience. Thank you for being such a wonderful guest.
Thank you.
So thank you so much, everyone, for joining us for this podcast. I believe you have learned everything you need to know about pulmonology as a branch, and now it can give you all the pros and cons for you to make a wise decision. Thank you so much for joining us here. And who do you want to be the next guest in the Nachiket Bhatia show? Please put it in the comment section. And as usual, do not forget to subscribe, like, and share. Thank you so much, and God bless you.